White House officials rolling out the plan to vaccinate kids ages 5 to 11. Within the next 2 weeks, federal health officials are expected to make a decision on authorizing Pfizer's COVID-19 vaccine for that age group. Today, the Biden administration detailed a plan if the vaccine for younger kids gets the green light. They say about 15 million doses will ship to providers within the first week, along with smaller needles for the smaller kids. They're also planning an educational campaign to make sure families get the right information about the vaccine. Our own Molly Oak spoke with a local pediatrician about what parents can expect.
What do you think is the big thing parents need to know?
What we do know right now is that the Pfizer vaccine, which is the one that's at the front line and would be most likely be approved first, will be a half dose. So it will still be a 2-dose series like the adult doses, but it'll be half the doses that the teenagers and the adults get. They're also administering it with slightly smaller needles. So that, again, is about the children being smaller. The side effect profile is supposed to be very similar to the adult vaccine. So maybe a little sore arm, fever, not feeling too good for a day or so, but nothing out of the ordinary is expected.
So parents can expect to have a kiddo that's probably not feeling too hot the day after they get the first shot and the second shot?
I wouldn't say necessarily expect, because most of the adults don't get that either, and most kids do really well with vaccines. So we don't see a lot of side effects with vaccines in general with children, but if they do get side effects, which is usually for the regular childhood vaccines might be 10 or 15% of the children, it's usually low acuity, such as a little fever or not feeling so good for a day.
It's been a long year and a half, to say the least. We haven't gotten to see family. Everyone's been social distancing. What's the timeline, of course, pending FDA approval on this? Could we see kids get this before Christmas and be fully vaccinated?
We do anticipate that children will be able to get the vaccines before the holiday season. What we do know is that the FDA has to approve the vaccine first, and then the CDC has to approve it. By all indications, that is supposed to be in the next couple of weeks, and we'll know more by the beginning of November. Once that's approved, it should roll out pretty fast. The United States has already bought 28 million doses of the pediatric vaccine in anticipation of this being approved, and so that they can ship it out to clinics very rapidly. Pediatricians and hospital systems are already being told to pre-order it so that they can get their dose right away. That said, children still have to come in to get the vaccine, and then it is a 2-dose vaccine 3 weeks apart.